530.
Welcome back. The largest public health emergency in generations. That's what one group is calling the opioid epidemic. Today, that group outlined ways the state can get ahead of the issue, including using marijuana tax revenues as a way to fund some of these programs that they're talking about. Our Capitol correspondent Morgan Mackay explains.
I lost control of my life, and I went going to jail, and I'm on drug court, and here I am trying to recover my life back.
Carmen Ayala says she fought hard to find her way through recovery. And now that she has made it to the other side, she explains the many challenges she had to face to get through the process.
The hospitals would not take me if you wasn't withdrawn enough. If you don't rate a certain scale number with your pulse being taken, you could wait 14 hours in that emergency room and not be taken.
According to the State Association of Alcoholism and Substance Abuse Providers, funding for substance abuse programs has barely kept up with the rate of inflation, while addiction rates continue to rise.
Some of the folks standing behind me, how frequently were they turned away from programs because there was not an open bed, or because there was maybe 15 open beds or 5 open beds, but no staff available to staff those beds and provide the treatment.
In Western New York, we have just a few inpatient facilities, and they are constantly full.
Today, the group outlined ways the state can invest back into these programs and provide incentives to people in recovery. They say it first starts with investing back into the treatment staff that are highly underpaid. Then they laid out ways these programs can be funded, including tax revenue from legalizing marijuana, the opioid surcharge fund, and by using Medicaid to allow for more access to medication-assisted treatment.
If we're going to create a roadmap out of this crisis, it has to rely very heavily on a workforce that is adequate to meet the needs of the people who need help.
Reporting from the Capitol, I'm Morgan Mackay.
Thanks, Morgan. Just last week, the synthetic opioid fentanyl was called the deadliest drug in the country by the Centers for Disease Control and Prevention.